Cold and superficial heat. Heat and cold are the most commonly applied therapeutic modalities, mainly because of the cost effectiveness, and they are easily available. The absence of heat is cold. Cold and heat use is conduction of heat to or away from the body. Application of cold decreases temperature of the skin and can get to deeper tissue. Application of heat increases tissue temperature superficially, and that's mainly on the skin layers. Deeper heating can be accomplished, but you need ultrasound and diathermy. These modalities are applied to help with recovery, but they can also cause injury. This is where you need to know the injury response cycle and the pain response. Energy always goes from an area of high concentration to an area of low concentration. There are 4 ways to transfer energy: conduction, convection, radiant energy, and conversion. Conduction. Transfer of heat through direct contact between a hotter and cooler area. The amount of temperature change is going to depend mainly on the temperature difference between the two surfaces and the length of time they are in contact. Surface temperature is always going to begin immediately. Deeper tissues take longer to cool. When a large area is heated or cooled, temperature at the center of the area changes more rapidly than the outer edges. The examples of these are ice bags, ice massage, and moist heat pack. Convection. Transfer of heat by the movement of air or liquid between regions of unequal temperature. The rate and extent of temperature change are determined by the difference in temperature between the medium and the tissue, length of exposure, and size of the area being treated. So examples of these are whirlpool and fluidotherapy. Radiant energy. Emitted from surfaces with temperatures above 0 degrees. Due to this, the body emits radiant energy but can also absorb it, and the superficial tissue is heated. An example of these are heat lamps, which actually are not commonly used anymore because there's an increased risk of burns. The amount of heating depends on the inverse square law, and that's the distance from the lamp, the cosine law, angle of the lamp, output of the bulb, and the length of exposure. Conversion. Energy is changed from one form to another. Not a form of superficial heat or cold, and examples of this are ultrasound and diathermy. Terms. Cryotherapy. The application of cold for therapeutic purposes. Cryokinetics. Therapeutic combination of cold and exercise. Example of this is range of motion exercises while using the cold whirlpool. Cold modalities. Ice bag. Why is crushed ice better? It conforms to the skin better and more surface area is covered. Why do we suck the air out? Air is an insulator, which causes the ice to melt quicker and the skin to stay warm. It increases the surface area covered by the ice. Commercial cold packs increase the risk of burns due to the possibility of a freezer being colder than 32 degrees, and it increases the likelihood of freezer burns because it adheres to the skin. Cryocuffs are game ready, less mess than ice packs, can use over wound dressings without getting wet. Ice massage. Colder than ice bag, and the main reason for this is because you have a continuous block of ice, which increases the surface area of ice in contact with the skin, and no air pockets to trap the heat. Ice immersion is going to be 40 to 50 degrees. Sometimes it's 55 in whirlpools. Vapocoolant spray. Very superficial, no temperature change below the epidermis, brief numbing of the skin, and may be effective in treating trigger points associated with myofascial pain. Cold whirlpool. 50 to 55 degrees. Warmer water is used in a whirlpool because the movement of the water continuously breaks down the thermopaine. This results in a greater cooling of joints with ice pack versus ice pack because greater surface area is exposed to the skin at all times, or greater surface area is exposed to the cold at all times.